Good evening, class. My research focuses on Black adults not receiving adequate mental health care, and the main components in my essay are systemic racism, unequal access to quality and culturally component care, and structural barriers within the healthcare system. My first point I'd like to address is the unequal access to quality mental health care. Research shows that Black adults receive mental health care at a significantly lower rate than white adults, even though they experience similar mental health needs. Something interesting that I found is about 25% of African Americans receive mental health care treatment compared to 37% of white adults, and that's a very large gap in care. My second point is how systemic racism contributes to long-term psychological stress. Studies have shown that prolonged exposure to discrimination, economic instability, and environmental stress increases rates of anxiety, depression, and trauma-related disorders. An important fact about these stressors is that they can often accumulate over time, and that means it can negatively affect the individual before they seek out care. My final point is about the cultural stigma and mistrust within the healthcare system. In the Black community, mental health is often viewed as a personal weakness if they were to try to seek out therapy. And that can discourage people from seeking out professional help, and it increases reliance on having support through family or religion. One thing interesting is that about 5.7% of physicians in the United States are Black, which limits access to culturally responsive care and contributes to lower levels of patient trust. And the perspective that's in my counter-argument is that research suggested that mental health disparities are mainly influenced by socioeconomic conditions and cultural coping strategies rather than factors related to racial bias or discrimination within the healthcare system. I argued, however, that research shows that Black males are diagnosed with schizophrenia at higher rates than white males with the same similar symptoms, and that Black women also experience diagnostic disparities in conditions such as borderline personality disorder, and that's suggested with clinical interpretation playing a role. And in conclusion, my research showed that mental health disparities are shaped by systemic factors rather than an individual choice. Addressing these disparities requires changes within the healthcare system and not just a personal coping strategy. Thank you.